It was never supposed to be filmed. A local news crew from KTLA was wrapping up a routine segment outside Cedars-Sinai Medical Center in Los Angeles. The year was 1989. The cameraman had already packed most of his equipment when he noticed something unusual near the service entrance. A man in a worn blue uniform was sitting on the concrete steps, his head buried in his hands. Standing over him was a figure in an expensive suit, gesturing aggressively, voice raised loud enough to echo across the parking structure, and walking toward them both, slowly, deliberately, was Charles Bronson. What happened in the next 4 minutes would be captured on a half-loaded camera from 60 feet away. The footage was grainy. The audio was incomplete. But what it showed was enough to make the evening news, then the morning talk shows, then newspapers across the country. Within 72 hours, the clip had been discussed on every major network. Within a week, letters poured into the hospital by the thousands. Within a month, legislation was proposed in 3 states to protect service workers from workplace harassment, all because Charles Bronson stopped. Charles Bronson was 68 years old that autumn morning. His knees ached from decades of performing his own stunts. His hands trembled slightly when he held his morning coffee. He had come to Cedars-Sinai for a routine checkup. His wife, Jill, had insisted, and Bronson, for all his on-screen toughness, never argued with her about his health. He arrived early, as was his habit. The waiting room wouldn't open for another 30 minutes, so he decided to walk. The morning air carried the faint smell of jasmine from a nearby garden. A garbage truck rumbled in the distance. The sun was just beginning to warm the concrete. Bronson wore no disguise. At his age, he had stopped caring whether people recognized him. Most didn't anymore. The young ones walked right past. The older ones sometimes nodded. He liked it that way. The silence, the anonymity, the freedom to simply exist as a man, not a movie star. He was walking toward the hospital's main entrance when he heard the shouting. Harold Mitchell had worked at Cedars-Sinai for 23 years. He started in 1966, the same year his daughter was born. He was 24 then, fresh out of the Army, looking for any job that would pay the rent. The hospital was hiring janitorial staff. The pay was modest, but the benefits were good. 23 years later, he was still mopping the same floors. Not because he lacked ambition. Harold had taken night classes for 6 years, earned an associate degree in hospital administration, applied for 17 different positions. Each time the answer was the same. We'll keep your application on file. The file went straight into the trash. Harold was the one who cleaned the operating rooms after surgeries. He sanitized the emergency ward after the gunshot victims and the overdoses. And he was the one who sat with patients in their final hours. That wasn't in his job description. Nobody asked him to do it, but Harold had noticed that some patients died alone. Their families couldn't make it in time. So Harold would finish his shift, clock out, and walk back to their rooms. He would pull up a chair and sit beside them, holding their hands, making sure no human being took their last breath in an empty room. He had been present for over 200 deaths. He remembered every name. The hospital never knew. Harold never told anyone. That October morning, Harold was exhausted. His wife Denise had been diagnosed with lupus 3 months earlier. The medical bills were mounting. Harold had picked up extra shifts, working doubles 3 times a week, sleeping 4 hours a night. At 7:15 a.m., he was mopping the hallway outside the administrative offices when Dr. Richard Carver walked through with visiting physicians from Europe. Dr. Carver was the hospital's chief of surgery, brilliant, but with a reputation for treating support staff like furniture. Harold stepped aside, but the floor was still wet. One of the European doctors slipped slightly, catching himself on a colleague's arm. He laughed it off. No harm done. Dr. Carver did not laugh. "What the hell is wrong with you?" His voice was sharp. "Can't you see we're walking here? Are you blind or just stupid?" Harold lowered his eyes. "I'm sorry, sir. I'll put up a wet floor sign right away." "A wet floor sign?" Dr. Carver stepped closer. "Do you have any idea who these men are? People like you are the reason this institution struggles. You contribute nothing. You're completely replaceable." The European doctors looked uncomfortable. Dr. Carver leaned in closer. "Look at me when I'm talking to you." Harold raised his eyes. They were wet. "I'm going to speak to administration about this. I want you written up. and if I had my way, you'd be out of here by the end of the day." He turned and walked away. Harold stood frozen for a long moment. Then he walked toward the service entrance. He needed air. He made it to the concrete steps before his legs gave out. Charles Bronson had seen a lot of cruelty in his life. He had grown up in a coal mining town in Pennsylvania, one of 15 children, so poor they sometimes had nothing to eat. He had watched his father die of lung disease when Charles was 10. He had worked in the mines himself as a teenager. He knew what it felt like to be invisible, to be treated as less than human. So when he heard Dr. Carver's voice echoing across the parking structure, when he saw a man sitting on the steps, shoulders shaking, something ancient stirred in his chest. He changed direction. The KTLA cameraman noticed Bronson approaching and instinctively raised his camera. Something in the way Bronson moved made him keep filming. Bronson walked slowly across the parking lot. His footsteps were the only sound. He reached the service entrance and stopped. Harold didn't look up. Bronson stood there for a long moment, 20 seconds, 30. He didn't speak. He just waited. Finally, Harold raised his head, saw a pair of worn leather shoes, followed them up to a face he vaguely recognized. "Mind if I sit down?" Bronson asked. His voice was quiet, unhurried. Harold blinked. "I don't mind." Bronson lowered himself onto the concrete step beside him. His knees protested. For a full minute, neither man spoke. They just sat together, watching the cars pass on the street below. Then Bronson said, "I heard what happened in there." Harold's jaw tightened. "You heard that?" "I heard enough." Bronson paused. "That man doesn't know anything about you. He doesn't know what you've done, who you've helped." Harold turned to look at him. "How do you—" "I don't," Bronson said. "But I can tell. A man carries his life in his face, and yours tells me you've carried a lot for a long time." Harold's eyes filled again. Bronson reached into his jacket and pulled out a small leather notebook. He wrote something, tore it out, and folded it carefully. "I'm going to give you this," he said, pressing the paper into Harold's hand. "It's a name and a phone number. A friend of mine runs a foundation for hospital workers, scholarships, emergency funds, advocacy. They help people who've been treated unfairly." Harold looked at the paper. "Why would you—" Bronson met his eyes. There was no pity in his gaze, only recognition. "Because I spent 20 years playing tough guys," Bronson said, "men who solved problems with their fists. But you know what real toughness is?" Harold shook his head. "Real toughness is showing up every day when nobody thanks you. Real toughness is holding a stranger's hand in the dark. Real toughness is standing there while some man in a suit tries to make you feel small and refusing to become small." He put a hand on Harold's shoulder. "You're the toughest man I've met in a long time. Don't let anyone tell you different." Harold couldn't speak. 23 years of invisible service, and finally someone had seen him. Bronson stood up slowly. He looked toward the hospital entrance. "One more thing. That doctor, what's his name?" Harold hesitated. "Carver. Dr. Richard Carver." Bronson nodded. Then he walked into the hospital. What happened next was never filmed, but 3 nurses and 2 orderlies later confirmed the story. Bronson found Dr. Carver in the conference room, still entertaining the European physicians. He knocked once, opened the door, and stepped inside. Dr. Carver's face went pale. "I met a member of your staff outside," Bronson said, his voice level. "Harold Mitchell. You spoke to him earlier, in front of guests. You humiliated him." The room went silent. "I've played a lot of villains," Bronson continued. "Bank robbers, killers. But I've never played anyone as small as a man who bullies the people who clean up after him." He leaned forward. "You're going to apologize to Harold Mitchell, today, in front of witnesses. And that write-up you threatened will never happen. Are we clear?" Dr. Carver nodded weakly. "Gentlemen," Bronson said to the European physicians, "enjoy your visit to Los Angeles." Then he walked out. The KTLA footage aired that evening. The segment was only 90 seconds. Grainy images of Bronson sitting beside Harold, the 2 men talking, Bronson handing over the folded paper. The audio was too distant to capture their words, but somehow that made it more powerful. By morning, the story had spread to every major network. ABC ran a segment called The Other Side of Tough. CBS interviewed hospital workers across the country. NBC tracked down Harold Mitchell for a 5-minute feature that made the anchor cry on live television. The story went national, then international. A French magazine called it the most American moment of the decade, not because of its heroism, but because of its simplicity. A movement emerged. People began sharing their own stories of invisible workers, the janitors, the bus drivers, the cafeteria staff, the night security guards who never got thanked. A businessman in Chicago wrote a check for $50,000 to a janitor's college fund. A school district in Texas implemented a policy requiring students to learn the names of every support staff member. 3 state legislatures introduced bills to strengthen workplace harassment protections for service employees. 2 passed within the year. Cedars-Sinai created a new position for Harold, Patient Comfort Coordinator. His job was to be present for patients who had no one else. Dr. Richard Carver resigned 6 weeks later, and Harold Mitchell received over 4,000 letters from strangers thanking him for his service and dignity. He kept every single one. In 1993, a documentary filmmaker asked Charles Bronson about that October morning. They were sitting in Bronson's living room. The afternoon light was fading. His health had begun to decline. "People ask me about my films," he said, "which one I'm most proud of. Death Wish, The Magnificent Seven. Good pictures." He paused. "But you know what I think about most? That morning at the hospital. That man, Harold, sitting on those steps, trying so hard not to cry. 23 years he gave to that place, and one man tried to erase all of it with a few cruel words." He shook his head. "I didn't do anything special. I sat down. I listened. I told him the truth, that he mattered. That's not heroism. That's just being a person." The filmmaker asked if Bronson had any message for viewers. Bronson was quiet for a long moment. "We spend so much time looking at screens. We watch heroes save the world in 2 hours, and then we walk right past the real heroes, the ones mopping our floors, driving our buses, taking care of our sick." He turned to face the camera. "You want to be tough? Really tough? Notice the people nobody else notices. Defend the people nobody else defends. Sit down with someone who's hurting and just be there." He smiled slightly. "Sometimes the smallest act is the one people remember the longest. Sometimes just saying, 'I see you,' changes everything." He looked away toward the fading light. "That's not a movie. That's just life. And it's the only role that really matters." Harold Mitchell retired from Cedars-Sinai in 2001 after 35 years of service. At his retirement party, the head of administration presented him with a plaque. "To Harold Mitchell, who taught us that dignity is not a position, it is a practice." Harold kept the plaque next to the folded paper Charles Bronson had given him 12 years earlier. Charles Bronson passed away in 2003. At his memorial service, the Cedars-Sinai footage was played one more time. 2 men on concrete steps, sharing silence, sharing humanity. In the audience, sitting quietly in the back row, was Harold Mitchell. He had traveled across the country to be there, because some debts can only be repaid with presence, and some moments, small, quiet, unremarkable to the rest of the world, become the most important moments of our lives.